Hi, my name is Katie, and I'm a graduate nurse at Aurora University, and I'm going to be doing a health assessment on you today. Do you have any questions before we get started?
No.
Okay, and prior to the patient entering the room, I did assess for gait, which was steady, and no need of assistive devices, and posture is good at this time. We also did take the patient's vital signs, and that is a heart rate of 72, blood pressure of 118 over 76, temperature of 98.2, and respirations at 14. And pulse oxygen is currently at 99% on room air. And I'm going to ask you a few questions before we get started. What is your full name?
Nicoletta Scott.
And what is your date of birth?
7/4/66.
And what is today's date?
12/15/15.
Okay, and where are we at right now?
Schneider Elementary School.
Okay, and do you know what we're about to start doing?
Yes.
Okay, so the patient is alert and oriented ×4 to person, place, and time. And before we get started, I just want to ask you a few questions. Do you have any history of any medical diagnosis?
No.
Okay. And have you ever had surgery before?
No.
All right. And are you taking any current medications?
No.
Okay, great. And what do you do for a living currently?
I'm a health assistant at the school.
Okay. And who do you live with in your household?
My husband and 2 children.
All right. Okay. And do you smoke cigarettes or have a history of smoking?
No.
Okay. And do you use alcohol or drink alcohol?
Occasionally.
Okay, great. And do you have any pain right now or any concerns?
No.
Okay. And if the patient did report any pain, I would assess it on a scale of 1 to 10, with 10 being the very worst and 1 being very little pain at all. And do you have any allergies we need to know about?
No.
Okay. So the patient appears free of physical distress at this time. Posture is relaxed. Facial expression is appropriate for this setting. And patient is not slurring their speech. It's consistent with rate and volume. And the patient's nutritional status appears appropriate for her age and stature. And first, we're just going to start by assessing. We'll start at your head and go all the way down to your toes. First, we're just going to check the patient for any lumps or lesions and make sure that the patient's head appears clean. There isn't any dryness or brittleness to the hair, and the patient appears well groomed. And have you had any head trauma?
No.
Okay. And then we'll continue on to the face. Sorry, my hands are cold. And just make sure the temperature is warm. There isn't any reddening or any unusual complexion to report. And the patient seems to not be sweating as well. And then when you look at the patient's face, the eyes and ears and nose and mouth are symmetrical. And then we'll also take a look at your eyes. I see you wear glasses. Do you usually follow up with an eye doctor each year for that?
Yes.
Okay, so I'm going to have you take off your glasses really quickly. And I'm just going to have you look straight ahead. And keep looking straight ahead. Okay? And then we'll do that to the other side as well. Alright, perfect. And then I'm just going to turn this off and have the object close to you, and I want you to follow it out and then back in. Great. And then the other thing we're going to do is I'm just going to take a look at your conjunctiva so you can open your eyes. Alright? So it does appear as if the patient's eyes are reactive and round, and reactive to light as well as accommodation, and there is constriction and convergence as well. The conjunctiva and eye is clear with light pink here at the bottom, which is also appropriate. And have you had any issues with sinusitis or trouble breathing, anything like that?
No.
Okay, so the patient's nose is not flaring. It looks as if air is moving in and out appropriately. And do you have any polyps? Have you ever had those?
No.
Okay. And then we'll take a look at the patient's ears. And just make sure that the auricle is flexible and that the tympanic membrane is present without a lot of earwax, so it looks good as well on this patient. Okay. So next we're going to go ahead and take a look at your mouth. Can I just have you open it really quick and say ah?
Ah.
Okay, good. And it appears as if the uvula is midline. The tonsils are present at about a 1+, and there isn't any dental infection at this time. Gums are light pink. Tongue is slightly rough with a slight white coating, which is normal as well. And now I'm going to have you look straight up, and we're just going to assess in this area and make sure that the trachea is midline, which it is. And a couple more things we're going to have you do. Let me grab this too. So first what I'm going to do is you can look back down, and you're going to smile and puff out your cheeks like this. Okay, and then we're going to have you raise your eyebrows and also close your eyes. Okay, and now you can breathe normally. So that's good. So the cranial nerve 7 is intact, and that's appropriate. And then I'm going to have you close your eyes one more time. And when you feel the pressure of the end of this Q-tip, I just want you to say now.
No. No. No.
Okay, so cranial nerve 5 is also intact in this patient. And next what we're going to do is start to check the rest of your body. So I'm going to have you look up one more time. And we're just going to palpate here for the patient's carotid artery, which it's not bounding. It's about at a 2+. It's strong, but not weak on both sides there bilaterally. The next thing we're going to do after palpating your carotid artery is we're going to take a listen to it with the bell side of the stethoscope. So let me do that really quickly. Okay, so upon auscultating for the carotid artery, there isn't any bruise present and there is no swishing sound. So that is good as well. And then next we're going to go forward with listening to your heart sounds. On the patient, we'll assess all 5 sounds here on the front at the aortic valve, the pulmonic valve, the point of Erbs, and then the tricuspid valve and the mitral valve. On the way going down, we'll use the diaphragm side of the stethoscope. So we'll do that really quickly. And when doing this, the aortic spot is at the second intercostal space. The mitral valve is at the second intercostal space on the left-hand side. The point of Erbs is at the third intercostal space. The tricuspid valve is at the fourth intercostal space. And then the mitral valve is here on the other side at the fifth intercostal space. Okay, so we're going to do that really quickly. On me. Okay, good. And then once we are here at the mitral valve, I will flip the stethoscope over to the bell side once again and listen to the apical pulse on the patient for 60 seconds. Okay, and after your 60 seconds is complete, you will switch it back over to the bell side and follow up with the mitral valve, the tricuspid valve, point of Erbs, aortic valve, and the pulmonic and the aortic going back up the patient. Okay. So in auscultating the patient, the S1 and S2 sounds are heard throughout, and S3 and S4 abnormal sounds are not present for this particular patient. In addition, the loudest points for S2 were at the aortic, pulmonic, and Erbs, and the loudest points for S1 were at the bottom here at the tricuspid valve and the mitral valve. There are no murmurs present, no rubs or gallops either, and the heart is at a regular rate and rhythm at this time. So the next thing we're going to do is auscultate for the lungs, and we'll start on the front side of the anterior chest wall for the patient. And we'll make sure to do all of these points here. We start above the clavicle. This is 1, 2, 3, 4, 5, 6, 7, 8, and then 9 and 10 here at the bottom of the lower lobes of the lung. So I'll do that now with the diaphragm side of the stethoscope. Okay, and on the anterior side of the chest wall, There is normal rate and rhythm. It doesn't appear as if any accessory muscles are needing to be used at this time. And they are clear, there's no adventitious sounds, rails, wheezes, or anything like that. And now I'm going to assess the back of the patient. I'll follow that same pattern with the 1 through 10, as well as the 11th and 12th spot here on the bottom of the lower lobes in the back. And I'll do this using the diaphragm side of the stethoscope. And you can just take deep breaths too as I do this. Good. Okay, and any lightheadedness or any trouble with breathing?
No.
Okay, so the posterior chest, there's also not any adventitious sounds, wheezes, or rails to report, and it appears as if there isn't any accessory muscle usage and the diaphragm is working appropriately. And the anterior-posterior chest wall ratio is 2 to 1, which is also appropriate in this patient, and there is no barrel chest present. Okay, so after auscultating the lungs, the next thing we're going to do is percuss using my 2 hands and my middle finger here along the back of the chest wall. You want to make sure to avoid the scapula as well as to make sure you're in between the intercostal space to actually hear the lungs. So I'll do that really quick. Okay, and then here on this other side. Okay, and then we'll also do that on the front as well. Okay. And then the other thing we're going to do is palpate both the anterior and posterior chest to check for the tactile ephemeris. And while I do this, I'm just going to have you say the numbers 99 when you feel me do it. Okay? Okay. And then over to the front, do the same exact thing. 99. Okay, perfect. And then one last thing we're going to do is check on your back here is for your kidneys. I'm just going to tap them and let me know if you feel any pain. Okay. So it doesn't appear as if there's any inflammation or infection of the patient's kidneys at this time. And then one last thing I'm going to have you do is kind of lean forward here. And I'm just going to assess the patient's spine to make sure that it is straight and in line. There doesn't appear to be any curvature either or any bulging discs or anything like that at this time. Okay, you can sit back straight up. Alright, now I'm going to have you lay down so we can assess your abdomen. So now that the patient is laying down, we're just going to assess the abdomen. We're going to make sure that there is a flat contour, which is good, and then it looks like the skin is of even tone and the umbilicus is also midline. There doesn't appear to be any lesions or scarring either at this time. So I'll first start by auscultating or listening to the abdomen, and we'll start at the right lower quadrant, and then move up to the right upper quadrant, left upper quadrant, and then the left lower quadrant. And we'll listen for a few seconds here in each one to listen for those bowel sounds. Okay, so the bowel sounds, you do hear gurgling, and there are about 25 sounds per minute, which is also appropriate on this patient. And the next thing we're going to do is just percuss and listen to each of the organs here, doing the same thing we did on the chest wall. Okay, and it will be most dull over the liver here at the top and the pancreas. And then there are more tympanic bowel sounds at the bottom, kind of over the intestines. And the next thing we're going to do is just palpate the organs and make sure that there isn't any issues there. And when you start at the bottom, you'll palpate over the appendix and the sigmoid colon. And then over here in the right upper quadrant, kind of palpating over the liver and the gallbladder. The left upper quadrant will palpate over the stomach and pancreas, as well as the spleen. And then the left lower quadrant will palpate over the sigmoid intestine there as well. So while I was doing that, was there any tenderness or pain that you experienced?
No.
Okay, so the patient doesn't report any rebounding, any muscle rigidity, or anything like that in the stomach area. And one other thing I'm going to have you do is just test your strength while you're laying down. So I'm going to push on your leg and try to have you lift it up. Okay, good. And we'll do that on the same side. Alright, and then I'll also do the same thing to your feet. I'm just going to push them back and have you push against it. Alright, great. So that is all good as well. And then I'm going to have you sit up. And as the patient sits up, I'm just going to check for jugular vein distension, which there isn't any, so that is good as well. And then we're just going to go through and kind of check your skin and each of your pulses here. So we'll start at the top, and if you don't mind, I'm just going to have you roll this up maybe to your elbow. And just looking at the patient's skin, there isn't any diaphoresis. It's not overly dry. Hygiene seems appropriate. There isn't any scarring or lesions or lumps at this time. So I'll just kind of feel here at the patient's brachial pulse. And that is even bilaterally about a 2+, and it's not bounding and it's not weak as well. And then we'll just kind of move down and make sure the temperature of the skin is appropriate, which it is. It's just warm to touch and skin is intact. And then we'll check the radial pulses. Okay, and that is also a 2+. It's not weak or bounding, but it is strong. And then we'll look at the patient's hands and just make sure that the nails do have curvature, which they do, and that they're not dry or brittle. And we'll check the capillary refill. And that is less than 3 seconds, so that is good too. And then we'll continue down your leg, and we'll just check your popliteal pulse, which is right behind your knee. Okay, and that is also a 2+. It's not weak or bounding, but it is strong. And then we'll come down here, and I'll have you take off your shoes really quickly. And then I'll just assess the dorsal pulse on the patient, and then the pedal pulse right kind of on the top there, part of the foot. Okay, and that is also a 2+ bilaterally. It is strong but not weak or bounding. And then let's just check here by your ankles. And it doesn't look like there's any edema or swelling at this time or redness, so that's good. And one last thing I'm going to have you do is just hold your hands out and do it this way. Then I'm going to have you grasp my hands too and check for strength bilaterally. That's even. And then let's just have you hold out both of your hands too. Okay, that's good. So we're just going to do a few more things while you have your shoes off. I want to do one other test. So we're just going to do this at the bottom and see if your toes curl in, which they should. Okay. Alright, so that's good. So the Babinski test is negative, and there is also plantar flexion, and inversion is also present. And one other thing I'm going to have you do is I'll have you stand up now. And do you have any dizziness or pain?
No.
Okay. And you're going to close your eyes. Good. And then I'm just going to have you put both of your arms out. And we're just going to make sure that the patient isn't swaying or dizzy. Okay, that's good. You can open your eyes. And that appears to be fine as well, so the Romberg test is positive. And do you have any other questions?
No.
Okay, thank you.